Hi, everybody. This is Dr. Rehwaldt doing a quick Zoom update. Kind of new territory for us, but we want to get some word out to folks about what's going on in the community. Lots of rumors out there, so I'm trying to quell some of them today. First off, we've been extremely busy at public health with a high new volume of cases coming in that we've been working on, trying to reach out to and get their contacts lined up and identified and called, and it's just very, very time consuming. We apologize for not having time to update our website. We're taking some steps to correct that. The county has stepped up and brought in some new team members, and we hope to have a rough update by the end of the day today, certainly by next week. But in general, we've had about 90 new cases added to our total case count. We were at about 313. For our cumulative case count since the start of the pandemic. We're probably up over 400 as of today, or in that neighborhood. Probably about 120 to 150 active cases because they've come in so fast. So there's definitely more activity out there. We have a lot of people under quarantine and isolation right now, trying to keep it in check. We're still trying to reach people quickly, and that's the biggest part of this job right now, is to reach out to people. And nurses are working really hard to make that happen. So we're pivoting a little bit, getting some new people to help us with the data project, and hopefully it'll go a little bit smoother next week. So moving on to some other big news. Everyone's probably heard about the new order that came down from the state health officer about a potential stay-at-home or shelter-in-place order that goes into effect. And it's triggered by regions, and what the state decided to do a few months ago was to start directing things at the state level by regions in California, because obviously Northern California is very different than Southern California. But the first rollout of this is actually this particular order, and what it really says is that if we reach a point where the ICU bed capacity is too low in Northern California, so us and all the neighboring counties across the northern part of the state, a stay-at-home order will go into effect. It'll be automatically triggered by that. And there is a lot of specific details to that, and it's kind of complicated to explain in a short session, but I just wanted people to understand that it is potentially on the horizon. It's not in effect today, but it certainly could come into effect next week. And people need to prepare because it's going to change a lot of things. It goes back to similar to where we were back in March. One of the big exceptional differences to the stay-at-home order in March is that schools will still be able to remain open. And there will be some retail services that will be able to stay open at limited capacity. And of course, the essential services that we had open during March will remain open. So it's similar, not quite the same. The state website describes it in detail, and I would advise people to seek that out online. It hasn't impacted us yet, but it definitely could, and it probably will. So I'm just wanting to be upfront with that and let people know. And the details are being posted at Roadmap to Recovery. I think our local website, it's on the public health page. There's the business connection in that series of web page windows. You go to that and look at it, and there'll be some postings of some of the details of what the stay-at-home order implies and how it affects certain businesses. And that's probably the best resource we have. And we will keep that updated as time goes on. It's going to change day to day because the state's going to be calculating our numbers and the ICU capacity in our region. This is an order from the state health officer because they want to put this surge to rest as soon as possible. If you wait too long and your ICUs and your hospitals are filling up or are already full, you've waited too long. So it's a big step for everybody in the state, and it's going to impact us. So people just need to prepare, and those are the best places to check for information, and we'll try and keep them updated. And I thank you very much, and we'll try and do this again next week.